In 10 years, you'll regret it if you don't start doing these 6 exercises right now. Many women who are currently 40 to 50 years old think they don't need to do these exercises. But later, when they reach 60, they realize it was essential to have done them because at 60 to 65, hip joints and knee joints start to hurt, thighs become flabby, and these women begin to feel very unwell. In reality, all of this could have been prevented. But don't worry, even if you are now 60, 65, or 70 years old, you can still do these exercises and you will gain many health benefits. I'm going to show you 3 exercises for the hip joint to improve hip mobility and 3 exercises for your glutes. The first 3 exercises are focused on increasing hip joint mobility. So once you start doing them, you will improve the health of that area and your hip joints will hurt and suffer less often. But that's not enough, which is why afterward we will also do 3 exercises to strengthen the muscles. This is very important for you to feel good. First of all, you'll get many benefits for your joints, hips, knees, and it will also significantly improve the appearance of your legs. And it doesn't matter if you're already retired, a woman at 60 or 70 can look very good if she really makes the effort. And as you can see, you can do these exercises right at home. I'm recording this video especially for you sitting on the bed, to show that early in the morning, right after waking up, you can do this set of 6 exercises. You should do it at least twice a week, and you'll receive many benefits for your health. So, here's the first exercise we should do. Look, the first exercise goes like this. You should position your legs this way, spread them slightly apart to sides, and do this movement. Look, we place our legs like this, and look to one side. Don't look straight ahead, look to this side, and then look to the other side. Your task is to do 20 movements like this, and do it regularly. Your task is to complete at least a few sets of this exercise. An excellent exercise. It improves hip joint mobility and improves joint nutrition. This way, the joint is lubricated, hurts less, and you feel better. You need to understand that having good mobility in this area is very important in old age because many people think that at an advanced age it's no longer important to stretch or do mobility exercises. And what happens? If you don't do these exercises, over time you develop muscle stiffness, your legs start to hurt, and your hip joint suffers. And very often, this eventually leads to needing surgery because the hip joint has deteriorated. That's why it's so important to do these movements to improve the health of this area. That's exercise number 1. If you can't do this exercise, if it's too difficult for you, you can do the movement with just one leg. In other words, move it out to the side and perform the motion. So, for example, this leg stays here. And you do it with just this leg, and then with the other. Look, you need to understand that this exercise should never be done through pain. If you do it while feeling pain, that's very bad. Any exercise should be done up to the limit of pain, but never through it. You may even notice something like this. For example, on one side, the movement of the hip joint is normal, but on the other side, you simply can't bring the leg into position. Don't try to force it. So, you'll do this exercise, and over time, the leg will start to go down more, and mobility will improve. But we never force anything. Then we move on to the second exercise. The second exercise is the classic butterfly. In other words, you sit down, for example like me, leaning against the back of the bed. Your spine should be straight. Under no circumstances should you sit slouched like this. Look, sit up and open your legs to the sides like this. You may also notice that, for example, one leg stays lifted like this, and the other one drops down a bit more. This happens when there are certain issues in that area. I don't recommend pushing forcefully. I don't recommend forcing it if there's a joint blockage. We don't force anything. We do this movement here. That is, we gently move the legs for at least 1 minute. If you're able to do the movement fully, like this, normally, that's great. But if on one side it causes discomfort, don't go through the discomfort. Only go as far as the zone where, for example, pain starts to appear. Don't go beyond that limit. In other words, we go up to the pain-free point and return. In the beginning, you might do it with this kind of range, and then after a month, you'll notice you can go deeper without discomfort. An excellent exercise, which is very often recommended for women who have issues with hip joint mobility. And now I'll show you a very interesting exercise that you're going to like. It can be done lying down, you can use a pillow, or do it without one. The movement goes like this. Look, you lie down, and here you can place a pillow. And we do this movement. Your task is to do these circular movements 10 times clockwise and 10 times counterclockwise. Don't try to open your legs as wide as possible, okay? When there is some muscle stiffness here, and it's hard to open your legs wide, stay within the pain-free range. Over time, after a few months, you'll notice that you'll be able to do a movement like this. Your task is really to make smooth and controlled movements. And look, don't take your legs too far apart, otherwise your lower back will hurt. So we do it like this, okay? Many people try to throw their legs way back, and what happens? The lower back lifts up right away. That's not good. We breathe, we don't rush, and now we do the counterclockwise direction. These 3 exercises must be done at least twice a week. They can even be done almost every day because hip joint mobility exercises are very important. First of all, your joint becomes better lubricated, its nourishment improves, and your overall health improves. As a result, coxarthrosis occurs less frequently. And this is very important, especially for women who are in menopause or post-menopause. During this hormonal restructuring, the amount of estrogen produced by the female body decreases, and consequently, the bones become more fragile, more brittle, and lose calcium. These women are often at risk of falling. So, when an elderly woman falls, especially if she's overweight, it can severely affect her health. For example, when a woman suffers a fracture of the femoral head or of the hip joint, that is very serious. What kind of risks? The risk of developing multiple blood clots. This is often exactly what happens to women. They lie down for a long time waiting for the joint to be replaced. It's not always possible to have this surgery quickly. They walk very little. As a result, the calf muscles don't work, don't contract. They're unable to take 5,000 to 10,000 steps per day. At most, they shuffle around the house with difficulty. And what does that lead to? It leads to the formation of blood clots due to the lack of movement, which can break off and cause pulmonary artery thromboembolism. And consequently, this often ends very sadly. So it's very important to understand all of these points because many women who suffer a femoral neck fracture have, let's say, a low survival rate, and that needs to be said to you here. That's why, in addition to exercises for hip joint mobility, it's also necessary to do exercises to strengthen the glute muscles. Why? Because the glutes help protect the hip joint. In addition, the glutes are involved in walking. They're part of the gait pattern, and they stabilize your posture in space, so to speak. With weak glutes, your walking posture isn't stable. That's why, lying right in bed, you can do 3 very effective exercises that will significantly improve your health. And the simplest and one of the most effective exercises, which you probably know very well, is the glute bridge. Your task is to lie down and lift your hips like this. Inhale at the bottom, exhale at the top. You might be able to do almost 50 repetitions. What should you do in that case? Do 50 reps? No. If you can do more than 20 reps, then simply do the exercise with one leg only. In other words, extend one leg and perform the movement, and at the top, exhale. And be sure to contract the glute muscles. An excellent exercise. So what do we do next? Suppose you did 2 or 3 sets of that exercise and rested for 1 or 2 minutes between sets. Next, we do this movement. Look, lie on your side and do this movement. Raise the leg upward. Look, the most common mistake. Many women rotate the foot upward. That's not how it should be done, because doing so activates the front of the thigh, but we need the glute muscles to work. So, make sure your foot is parallel to the bed or tilted slightly like this, and the movement should be like this. You don't need to raise your leg too high, about 30 degrees. Lie down on your bed right now, and do at least 30 reps of this movement. If you're unable to do 30 repetitions of this movement, your glutes are very weak, and that can negatively affect your health. In other words, every woman, even elderly, should do 30 repetitions of this movement. This will ensure protection for the hip joint. How? By strengthening the glute muscles. And then once you've done 2 or 3 sets like that, we move on to the next movement. Notice, position your legs like this and perform this abduction. Under no circumstances should you make sudden movements, like lifting the leg in such a way that the other leg gets out of position. We do the same thing, 20 repetitions. Inhale here, exhale there. If you can easily do 20 repetitions like this, then place your hand here. In other words, press your hand in this direction to create resistance. So you should do around 20 repetitions like this, and in total, 3 sets of this exercise. Look, so we now have 6 exercises. You need to do this full set at least twice a week. As for the first 3 exercises, you can do them every day because they are focused on hip joint mobility. This is very important. And these exercises really don't require much effort, so they can be done daily. The next 3 exercises, however, should be done at least twice a week, but not every day. You can increase to 3 times a week, and after a few months, even up to 4. And this will have a very positive effect on your health. And again, you need to understand that the health of your hip joint depends on many factors. It's not just individual exercises that determine the future of your movement. It's a combination of daily choices that together create long-lasting protection for your bones, muscles, and joints. You must abandon harmful habits such as prolonged sitting, smoking, excessive alcohol consumption, and the routine of spending hours sitting without changing position. All of these worsen circulation, weaken the joints, and accelerate muscle loss. In addition, eating properly is essential. Consuming an adequate amount of dairy products or other sources of calcium helps keep your bones stronger. Many women over 50 don't realize that insufficient intake of this mineral over the years directly contributes to bone fragility. It's also important to ensure adequate vitamin D, which helps absorb calcium, as well as enough protein to maintain muscle strength. Without strong muscles, especially around the hips and glutes, the joint lacks support and begins to suffer premature wear. And of course, doing specific exercises for hip joint mobility is essential. Proper mobility prevents stiffness, reduces pain, and improves the hip's natural lubrication. At the same time, strengthening exercises, especially for the glutes, create stability during walking, reduce the impact on bones, and help you maintain a safer and more stable posture. Naturally, if you are able to squat and perform more complex and dynamic exercises, you should do them. These exercises activate large muscle groups and can be even more effective than the movements done in bed. But if you are a woman who is overweight, already experiences joint pain, or struggles with movements like squatting, sitting and standing, or static exercises, know that these simple exercises can literally save your hip joint. They are a safe bridge to regain strength without causing overload. Understand that the best thing of all is prevention, taking care of yourself today so you don't suffer tomorrow. Prevention is always easier, cheaper, and less painful than treating an advanced hip problem. It will prolong the health of your joints, reduce the risk of falls, and help you avoid serious complications like fractures. However, if you already have any kind of health condition, severe pain, or significant movement limitations, I strongly recommend that you consult your doctor before starting this exercise routine. They will be able to assess your specific condition and suggest safe adaptations to ensure you get the benefits without unnecessary risks. It's possible that the condition of your joint is already so compromised that, in that case, exercises may no longer help, and urgent medical attention may be necessary instead. So take care of yourself, and also take care of your family members and those close to you.